At Mayo Clinic, we take pride in being able to treat the rarest of the rare cancers and the most complicated cases. And we provide exceptional expert level advice and care and help co-manage some of these complex patients closer to home with our referring providers.
Since all of us here are subspecialized in a particular type of cancer, we are able to weigh in and give sometimes a second opinion to support our amazing colleagues in the community with one single goal. We want what's best for the patients.
For patients with lung cancer, we can provide a multimodal treatment approach. And we have the cutting edge technology and the expertise that will allow us to, for example, make a diagnosis and treatment in one procedure.
All of us meet as a team to kind of discuss patient's situation, condition, and all the test results to come up with a very personalized treatment approach.
We'll bring that patient to our multidisciplinary tumor board, which has radiologists that will go over the imaging of the patient. We have pathologists, we have surgeons, our medical oncologists, and we have radiation oncologists, and we have our pulmonologists. We have multiple from each of these specialties. So we really get a nice, well-defined treatment plan by the end of the discussion.
This technology called robotic bronchoscopy allows us to reach out to anywhere in the lungs, and a mechanic arm that we guide with a console, and we navigate inside the lungs of the patient with very, very low complication rate. Regarding treatment, we use the robotic platform, so we are able to reach to the nodule and perform this ablation technique, which the goal is obviously to kill all the malignant cells inside the nodule. And we have had this technology available only in the last year. And we are one of the leading centers globally in that technology.
We have the ability to deliver arc therapy, so have the beam on going around the patient. This can help deliver higher doses to a certain area and very low dose to more critical structures, making the treatment much more tolerable. We're going to be having proton therapy in the very near future and even carbon ion therapy. All of these will help us really improve the therapeutic ratio, which really means reduce side effects and maximize cure rate.
Here at Mayo Clinic, we're very proud that we have many clinical trials for patients with all types of cancer, and including lung cancer in particular. Some that are, again, comparing some newer agent or a newer targeted therapy compared with the standard of care therapy.
When we think about cancer management, it is really important to actually have a team of doctors that specializes in managing the complexity of cancer.
We're talking a targeted therapy response rate, meaning shrinking the cancer meaningfully, could be anywhere from 60, 70, and reaching 80% or more sometimes. This is something we have never had 15, 20 years ago. I truly believe it is an era of hope for patients with lung cancer. And it's evolving where I am very confident that next 6 months, next year, it's going to be even better.
We do not believe that one treatment or one approach fits everyone. So the personalized care is essential, and that is where the referring physician is also essential.